Welcome back, everybody. According to the National Cancer Institute, nearly half of all women 40 years old and older have dense breasts. And that makes it more difficult to detect breast cancer. And while we hear a lot about breast cancer, the topic of breast density is less discussed. Now, we have this pumpkin here this morning with us, and we're going to get to that in a moment. We're not crazy. There's a reason for it. But we have Dr. Christopher Formen of Northland Radiology with us. Thank you for being back. You always do such a great job explaining things for us. So let's talk first, what is breast density? Explain.
So breast density, essentially 4 out of 10 women have what we would consider increased breast density. So it's very common. You'll find a lot of times that we can figure out what your breast tissue looks like from your initial mammogram. So fibroglandular tissue is dense breast tissue, and fat is less dense. So if you look at this graphic we have up, the image to the left shows a breast which is almost entirely composed of fatty tissue. Now, as we move towards the other end of the spectrum, you can see that image on the right has a breast that has a lot of fibroglandular tissue. So that's basically, we use those 4 categories to basically categorize every woman and their breast density.
So does the breast density complicate the screening process then? Is it more difficult to see breast cancer or to see issues in the denser tissue?
Yes, that's exactly right. So what happens is you're looking at basically a 2-dimensional image, and you're looking at lights and darks. So things that are bright are things like fibroglandular tissue, normal fibrous tissue, but also calcifications, which can be associated with cancer. And cancers themselves can be bright as well. So basically all of these things overlap and make it difficult to separate the individual processes.
All right, so how can women determine their breast density? How can we tell if we have it? Do you need a mammogram to do that, or are there other ways? You
do. And fortunately, there's a system in place so every radiologist that does mammography associates and assigns you a breast density. So you know going in if I have, less dense breast or very dense breast. And you can talk to your practitioner and kind of help you determine which tests would be useful to kind of sort through some of that stuff, because it can be difficult.
Is there any correlation between breast density and breast cancer?
That is a very good question, and no, there is not. Okay, so while there is no correlation, I mean, we're all made differently.
Right.
But dense breast can make it harder to detect small and obscure cancers.
Okay, so let's show, when we're talking about breast density, that's why we brought the pumpkin.
Yeah, that's our pumpkin. So again, work with me, use your imagination here. This pumpkin is a breast. So essentially, one of the technologies we're going to use is something called ABUS. That stands for Automated Breast Ultrasound.
Okay.
And this is a new tool we have to basically sift through dense breasts and help us determine what's normal breast tissue and what could potentially be cancer. So we have this pulp that we've basically taken out of the pumpkin, and the pumpkin is our breast. The pulp is that fibroglandular or fibrous tissue. The seeds are little hidden cancers that are in a breast that we could potentially miss. So what automated breast ultrasound does is it uses sound waves to essentially go through that tissue and separate the fibroglandular tissue from the seeds. So you can see the little seeds in here. This is kind of a poor representation, but it's close. Let's just use our imagination.
Yeah, no, I think that's awesome. Thank you so much. You break everything down so well. To learn more about breast density and screenings, visit nkch.org. Thanks again for being here.
Thank you.
Well, coming up